Good morning. Happy Friday and start of the holiday weekend, everyone. I'm Kevin Captain, Interim Director of Community Information for Volusia County Government and your moderator today. Thank you so much for joining us. This is the County of Volusia's weekly live panel discussion. So, while far from a full return to normal, our state and our county continues to open back up, and we're well on our way to recovery and renewal. That's the good news. Still, for some, fear may be keeping them from seeking needed diagnostic care and treatment at hospitals and at emergency departments. The reality is that avoiding hospitals out of fear could have long-lasting health consequences. That's especially true for serious medical conditions such as heart attacks, strokes, abdominal pain, or trauma, where early treatment can be absolutely critical to patient survival. Delaying medical care out of fear can be dangerous, perhaps even deadly. It can carry deadly consequences. But the experts here today tell us that you don't need to be afraid, because just like other businesses, and even more so, hospitals have updated safety procedures with the COVID-19 pandemic. Emergency departments are open in Volusia County and prepared, like they've always been, to deal with life-threatening situations. The message here, the very urgent message, is don't avoid emergency care when it's needed. The consequences could be far worse than the small risk of exposure. Here today to talk about that are three experts in emergency medical care. We have Dr. Peter Springer, an emergency physician and Volusia County's operational medical director, who's also heavily influenced with EMS and writes the protocols for our EMS professionals. We have Dr. Stephen Veal, the Medical Director of Emergency Services at Halifax Health in Volusia County. And we also have Vito Petrosino, the Assistant Medical Director of Emergency Services and the Chief of Medicine at Advent Health in Daytona Beach. So thank you, gentlemen, for being on the panel this morning. We certainly appreciate you being here. And we thank you for our online viewers. So for those of you who are following along on Facebook, we know that you might have some questions for our panelists. Feel free to type them in and into the comments, and as the discussion is going on, time permitting, or at the end, we'll do our best to try to answer those questions for you. And with that, we'll go ahead and we'll get started. So Dr. Springer, from the county and the EMS perspective, what are we seeing? And are we experiencing a decrease in the number of 911 calls or EMS transports?
Yeah, Kevin, that's a great question. Initially, when we first started this pandemic, and when we were starting to shut down our businesses, we actually did see a pretty steady decline in our 911 calls. That was both through our dispatch center as well as through our transport agencies such as EVAC, as well as some of the municipal transport agencies. Fortunately, I think people are realizing that we are trying to do the best job we can to protect them, and so our numbers are picking up. Actually, our dispatch numbers are pretty close to being back to normal, and EVAC and our municipal transport agencies are actually picking up as well and getting close to being back to normal.
And that's good to see the volume get increased. Now, when EMS goes to any call, can you speak a little bit about the personal protective equipment that they have and what they have to wear?
Sure. It doesn't start with EMS. It actually starts with dispatch. So when the CDC came out with recommendations, and early on they were daily or sometimes twice daily changes in how EMS should respond. We actually worked through our Volusia County Sheriff's Office Dispatch Center and made sure that we actually addressed those items that they said were high priority, at least things that we should be alerted to. So through our dispatch center, we actually modified our dispatch protocols and made sure that our dispatchers were actually asking the appropriate questions, not only to those who had flu-like symptoms or respiratory symptoms, but for every call that they took. So anyone that called 911 through the dispatch center, whether it be for law enforcement or for medical or for fire, would be asked the same screening questions for possible COVID type symptoms. So it started there. Once they identified a patient that potentially could fall into a risk category, that would be typed into our computer terminals so that EMS crews were alerted to the potential symptoms and the potential risk of the patient having some symptoms. It didn't stop there, though. Once we, got more information and saw, across the country, actually across the world, that patients were presenting in many ways that we didn't initially see, we made sure that we were actually protecting everyone, including the patient and the providers. So shortly after initiating, we followed CDC guidelines and made sure that the patients were being masked with surgical type masks, and that our crews were minimizing their exposure. So rather than having a 3-man crew or 2-man crew go into the house and evaluate a patient, if the patient was able to ambulate, we would ask that they would meet the crew at their door or on their patio or porch, have one crew evaluate them, and assess the risk. If there was significant risk, then they would be the sole provider caring for that patient unless there was a requirement for more hands-on treatment by other providers. Again, just trying to make sure that they were protected appropriately in the PPE, mask, gown, goggles, as well as the patient, and alerting the hospital when they arrived.
Those are very proactive measures. And, I think an important point that you mentioned there is when we're looking at how we're all responding to this pandemic, for many of us, it's the first pandemic that we're going through. And when you mention the CDC guidelines, that's changing because as we continue to learn more and more about coronavirus, the guidelines are changing. And so the dispatch questions that you're using, I imagine those are being reevaluated day in and day out, and it's a very dynamic process.
Absolutely. And we have such a great working relationship with the Sheriff's Department and the Sheriff's Dispatch Center that it's really seamless. Once we have a change, it's almost done immediately. And so I can't thank them enough and appreciate the collaboration that we've had, since I've been in this job since 2006.
Excellent. Well, so perhaps really the biggest thing to talk about today is the reluctance of residents in seeking care in the emergency department. And so I've got a combination of questions here. They're all kind of sort of germane to this topic. So we've heard from many residents that they're worried to go to the hospital during this pandemic because they have a fear that they might get the virus. And what are you seeing in terms of patients delaying potential emergency care? What are some of the risks of delaying a visit or even foregoing a visit to the ER when a person might be experiencing something like, say, chest pain or stroke-like symptoms that are, true emergencies?
Sure. I would say, fortunately, I think we're seeing some of that reluctance wane as people are getting more comfortable and feeling more reassured. I think most people realize at this point the hospital is probably one of the safest places to be in the community because of our infection control procedures that we're experiencing and have in place. I think for a while we were seeing people that were delaying seeking treatment for things like strokes or things like abdominal pain that turned out to be appendicitis or something more severe, sort of hoping that it would go away, things that they may have sought treatment for earlier, previous to the pandemic. I think we're seeing some of that reluctance wane now, which is good, and we certainly want to encourage people to seek treatment for if they're experiencing symptoms of an emergency and they don't need to worry that they would contract the virus in a healthcare setting. We've been, dealing with this for several months now, and what we're realizing more and more, this rigorous adherence to infection control procedures are really effective at controlling the virus when they're applied appropriately. So isolating patients early who have respiratory symptoms and infection control procedures, frequent cleanings of surfaces, and masking of employees and visitors and controlling the entry points have really been effective in keeping patients and staff members safe.
Excellent.
Mm-hmm. Yeah, in terms of how we are at Advent right now, we have implemented numerous safety measures in order to protect our patients, to protect our staff. First and foremost, you see it when you enter the hospital at the main entrance. We do temperature checks on every single person that comes in the hospital, staff included, patients and visitors. Every person that comes into the hospital is given a mask, and there is hand sanitation right there at the entrance, so everybody's expected to use that as well. We do employ social distancing within the hospital. There are marks on the ground that represent 6 feet apart. They're measured 6 feet apart, and that's throughout the hospital. As well as in the waiting room, chairs are separated. And we have more waiting areas so that people can isolate themselves better while they're in the hospital. Additionally, we have really amped up our PPE for all staff, so everybody has a new mask, and gloves, new gowns for every patient.
So physical changes, operational changes. So last week in the panel, we had Dr. Scott Cleos and Dr. Andrea Cleos, and what was interesting is they actually discussed some of the specific examples of things that they're seeing. Like one thing that Dr. Scott Cleos, being a radiologist, said, he talked like you, Dr. Veal, and he mentioned stroke. And he mentioned, we're teaching the community how important it is to identify people with stroke symptoms and how much of a medical emergency that it really is. And he described a case in which, they were fearful, and unfortunately then parts of that patient's stroke got worse, and so they had long-lasting deficits. And another example Dr. Andrea Cleos mentioned was somebody who had just had a small skin tear who probably really needed to have it checked out on a sort of urgent basis, and then it turned into a full-blown sepsis a couple of days later, and again, they were reluctant to seek that. So even though we're talking about chest pain and strokes and those true medical emergencies, sometimes even the ones that might not appear to be immediately medical, are you seeing some of those too, that when they come into the ER right now, are they in more acute cases that are more significant?
Yeah, we definitely have been seeing some of that. Again, I think the public is getting more comfortable with utilizing healthcare resources coming to the hospital for things that they need urgent medical treatment for. But certainly, we've done such an aggressive campaign about education regarding stroke in particular. Those symptoms are sometimes subtle and often disorienting, and trying to encourage the public to recognize that as an emergency, because we know that the treatments are extremely time sensitive. So we have been seeing some delay in that. But again, I think people are getting more and more comfortable with that the hospital is a safe place to come and a safe place to receive care, and that there's risk for delaying that. So hopefully we'll see more and more of that wane.
Good. Good.
Yeah, an interesting statistics. The American College of Cardiology actually reported that there was a 40% decrease in heart attacks and strokes that were being treated. So they're not getting treatment for it, and they were staying at home. Patients were coming in 6 hours to days after their acute chest pain started, and their hearts had infarcted more than they otherwise would have. Treatments for strokes and heart attacks is time sensitive. So, if we can get you into the cath lab or get you the treatment that you need right away, the prognosis is going to be much better.
So that data suggested that the actual treatment levels are down.
Correct.
But it probably, by inference, represents that people are still having their medical emergencies, their chest pain, their heart attacks, but they're delaying it.
Right.
And they're not, therefore, getting into the statistical metric for us to be able to measure to see, are they being treated? But like you said, when they come in infarcted, that means that they come in and their hearts, it's got more severe, long-lasting damage?
Yeah, so their prognoses are worse. So they're just not doing as well as they otherwise would have if we could have intervened on them sooner.
Couple of very key messages there.
Yeah, to piggyback off that, we had discussed this previously in a previous panel. It was probably 2 to 3 weeks ago, I was on a state EMS conference call, and one of the directors was actually making reference to an increase in out-of-hospital cardiac arrests during this pandemic, that they had seen statewide a sharp increase. Which in turn means that people were not seeking treatment and unfortunately were succumbing to possible cardiac events that could have been treated had they called 911. So we saw a decrease in the 911 activity with an increase in out-of-hospital or in the community cardiac arrests. So I think by having panels like this, we can get the word out, but do not delay. It's certainly not worth it. And we will do every job we can to make sure that we protect you from being exposed to this virus.
Yeah, maybe we can get into it later about some of the specifics of disinfection in the hospital. But, Dr. Springer, we know that Volusia County is the only county in Florida and very few areas in the country that has highly experienced registered nurses who are also clinicians in our area emergency departments, and they're working in the dispatch center and they're taking calls. What does that process look like in Volusia County if somebody, say, for example, has chest pain and they call 911 today for a medical emergency, and under your direction and guidance and as well as through the sheriff's office, what happens? How does that work?
Sure. Yeah, it's another great example of a collaborative effort that we've had with our dispatch center. Fortunately, those types of calls, if someone calls in with chest pain or anything that's considered significant or an emergent condition, they won't go to the nurse triage.
They go right to the-
They
to
go
the-
right to the 911 lights and sirens, getting them to the hospital as quick as possible. But what we saw is a significant trend and increase in patients that were utilizing the 911 system for minor issues that really didn't need to be seen at a hospital, potentially could have been seen at an urgent care or doctor's office, or sometimes not even needing to be treated at all, just needing some good sound nursing advice. So, this was in an effort to free up our ambulances for true 911 calls. So what we did is we with county council approval, started our nurse triage program, and we hired 7 highly qualified ER nurses representing both hospital systems, actually 3 hospital systems, including the ER in Sanford, Florida. And what we did is we put together our own protocols for low acuity type calls. We're talking about sprains, scrapes, cuts, URI type symptoms, upper respiratory infection symptoms, things that really don't need an ambulance and a fire crew showing up at their house. So what we would do is we would address those calls, identify them through our initial dispatch. Once they'd ruled out an acute emergency or acute medical emergency, then the call would be transferred to our nurses who are on call in the actual dispatch center. We put our nurses through the same dispatch training that all of our telecommunicators go through. That's a 280-hour course.
Wow.
So they were, certified telecommunicators. So what they were able to do is actually spend more time with the patient than what they would normally do with a dispatch call, and kind of ferret out the specifics to the patient's presentations. Now, certainly some of these calls actually needed to be taken to the hospital by an ambulance, but they didn't necessarily need an ambulance and a fire truck showing up on their property. But a lot of those calls could actually be recommended that they take alternative transport, i.e. their own vehicle, a friend's vehicle, or even maybe a taxi cab or an Uber at that time. And it didn't necessarily have to be the emergency department. It could be an urgent care, it could be a doctor's office.
It seems like great synergy and collaboration there, because they're nurses that are clinicians. They
Right.
work in our area emergency departments and as you said, the 3 systems. But then they're also trained as dispatchers.
Right.
So what an amazing combination of all the different hats that they're wearing.
Yeah, they're wonderful. And, and the good thing is they know the community.
You sure?
So these are the same patients that they see when they're working in the emergency departments. So it enables them to use their clinical skills and their clinical knowledge that they use on a face-to-face basis through the telephone. And we've actually had very great success with this program, and I think that it's only going to grow. And so we're really proud of it, and certainly, like you mentioned, it's the only program in the state of Florida. There's 4 or 5 across the country, and I think it makes us a progressive system, which I think our citizens deserve.
It makes it all inclusive, and it also benefits the hospital systems as well. That's
Absolutely.
wonderful.
Yeah.
So speaking of the hospitals, let's talk about if I'm a patient and I go and I access emergency services and I walk through that door of the emergency department, how is it different today through this pandemic in terms of triage and, the separation? And because I understand, there's COVID units is what we've heard, and in different areas, because that's all part of the fear that people have. When they enter those doors, I think that there's a fear that, hey, I might get COVID, or it might be in the air. I mean, what's it look like when they walk through the door, and what's the process as they navigate and mobilize through the departments?
Sure. So I think from the first thing I'll notice is they'll be greeted before they even come through the door by a staff member who's doing the screening, looking for symptoms or exposures, anything that would determine the person is of higher risk than the general public. Those patients can be escorted immediately to an isolation room if they are, say, known positive from testing in the community already, or high risk because of a household member with symptoms. Every patient and visitor is given a mask to put on to prevent any potential spread to protect them from infection and to protect other patients that could be infected by them. Staff members similarly are all masked as well. As far as triage, everybody has a heightened awareness looking for respiratory symptoms. We have a separate waiting area for patients who are symptomatic with respiratory symptoms, whether it be from COVID or other respiratory infections like influenza or the flu. And then dedicating areas of the hospital where patients with respiratory symptoms don't go. Particularly surgical floors for patients like oncology patients or immunocompromised patients, patients receiving elective procedures for knee replacements or other urgent procedures, dedicating those areas as not receiving patients who have other respiratory symptoms or maybe potentially infectious. So doing everything we can to protect really the patients that come through the doors, protect staff members, and keep everyone safe while continuing to provide that high level of care.
So not just in the ER, but throughout the entire facility, there's a categorical separation of patients with certain symptoms, and they're kind of sequestered or separated out.
Yeah, and with dedicated staff members as well, so that you can minimize the staff members that are caring for both types of patients, keeping that separated, and that reduces the risk of any kind of transmission from one unit to another.
Excellent.
Mm-hmm. Yeah, we're essentially doing the same thing. We're cohorting COVID patients, patients who are under investigation. Let's say they haven't had their testing results yet. They're also cohorted in a separate area, so like an intermediate risk area. And then our low risk area are people who are being admitted for other reasons other than respiratory symptoms, and patients who potentially have the virus. And that's seen at all levels of the hospital. So that's also in the ER. If patients are initially given a questionnaire that we have that have several questions on it, and if they respond yes to any of the questions, they are isolated until we can prove clinically or by testing that they do not have a COVID infection.
So with the increase or heightened awareness of sanitation and disinfection measures, would you agree that perhaps going into the hospital right now is arguably safer than it would be to go into a different public domain?
Mm-hmm. The hospital is probably the second safest place to go besides being in your own home.
Would agree.
Interesting.
Yeah.
Interesting.
Much safer than going to the grocery store, than going to the gas station. We've really ramped up environmental services and cleaning and disinfecting all areas of the hospital many more times than we had in the past, as well as an increase in the high traffic areas in the facility.
Excellent. So as we more mature with the reopening phases, and now we have restaurants at 50% capacity, and we're going to continue to look at the public health data and the gelling of all the information and facts from our medical experts like yourselves and other public health officials. What do you think about the more businesses opening, and what messages might you all have for some of those from small business owners to large business owners here in Volusia County?
So I'll take the question. In terms of reopening, I do feel like it is safe to start reopening as long as you adhere to the guidelines that are recommended by the CDC. As well, Advent Health has created a website that has best practice guidelines on how to open up your business safely, to keep your employees safe, as well as to keep your patrons safe. That website is adventhealthcflsafebusiness.com, and on there you can actually go and tailor the strategies to your business on there.
Excellent. I think the Daytona Chamber has a similar site as well, too, with products and information for small businesses to be able to look at, ideas and placards and things like that to help get the message out for people to stay safe.
Yeah, I would say I think that the small businesses and the larger businesses as well have adopted the right mindset. I think initially everybody was hoping for sort of life after COVID. And I think we've realized that we really have to look at life with COVID and making sure we're taking the right preparations and steps to protect staff, protect patrons. And as I've been, kind of going around town and seeing the businesses sort of adjust, figuring out how to open, going through this process, it's been inspiring to see everyone sort of come together and figure out how to do it. And so, yeah, I think that I think we're doing well. It was great to speak with the governor and see his sort of vision for opening the state. I think he's doing a great job with the doing it in a stepwise fashion, looking at the data, taking the next steps, being firm where we need to be firm on areas like nursing homes and residential facilities, and then opening up where it's appropriate, like the beaches and the businesses, and seeing where it is. I think individuals also will have to develop their own plans. So businesses are developing plans about how they're going to open and be safe. I think individuals and families will have to have their own, assessing whether they're high risk for infection, and what does that mean for them, and what sort of practices should they institute in their home or with their families. So I think we're all sort of figuring that out. But I'm very optimistic.
Our message again to the public, to reiterate, if you have any indication of needing emergency medical care, it is safe to seek care in our local emergency departments here in Volusia County. As the physician experts today have said, perhaps the hospital is the second most safest place to be, first being your home. With that, we'll close this panel today. Take care and stay safe.
Stay connected with the latest Volusia County news, events, and updates on our social media channels. Like and follow us on Facebook and Twitter. Catch up with previous stories on YouTube, or just head over to our website, volusia.org.